Hi, everyone, and welcome to today's panel about the health and wellness industry post COVID-19. Before we jump into the discussion, I want to give you a little bit of context about the health and wellness industry and a little bit of an overview of the topics that we will discuss today with our guest. The first thing that I want to highlight is that because of this COVID-19 pandemic, all of a sudden, everyone realized how vulnerable our health is. We started listening to our bodies, measuring our temperature, oxygen saturation. We started exercising because of these multiple lockdowns. And we also started worrying about our mental health because we were indoors so much. And because healthcare facilities were so hard to access, a lot of people started using technologies. And we will talk about this today. Things like telemedicine, at-home test kits, remote monitoring for chronic diseases, and all of these technologies and digital solutions. And while patients were using technology to compensate for the lack of traditional care, governments were also betting on technology to help stop the spread of the virus. And all this use of technology led to questions about the security, the privacy, and also the ethics behind the use of digital technologies. And this is also a debate that we will cover today. So before starting our panel discussion, I will let all our guests today introduce themselves. I'll be your moderator. My name is Anca. I am a pharmacist by training, and I have been working in the health and tech industry for the past 5 years, educating people on this topic. So I'll just let you introduce yourselves one by one. Maybe we can start with Prakriti.
Thank you so much. I would love to say good morning, but a lot of us are in the evening as well, in the afternoon, so good afternoon. I've actually been in the health and wellness business, mostly holistic well-being, since 2000. I have a foundation that does mental health awareness in India. It's actually very focused on just information education and communication and really getting people to understand the importance of mental health. I do have a company that does integrated well-being, which right now is becoming quite popular. It's actually quite an old clinic that I run. And currently, I've taken on the role as the global head of mental health and well-being at Roundglass, which is a digital wellness company and a digital well-being company. And we're focused on creating solutions that will actually override and assist on almost cradle people during not only this period, but for the foreseeable future. And we're really building out to understanding the depth of what's needed in the well-being space. That's a little bit about me. Thank you.
Thank you. Widy?
Oh, thank you, Anka. Humble beginnings. Early on my career, I was a part of component design for a family business, a machine shop. We grew the business to system design for automation, specifically for life science, and that's why I got the bug of working for life science and medical devices. Then my career gave me a path into high-speed electronics for automation. I then I did learn a lot about high-speed manufacturing for wearables and personal electronics. Um, Created a team for design on those particular components. So move from the manufacturing part to then the component and device design, specifically again in electronics or wearables. Um, then manage that product design team on different organizations up to this point where we are working together in Telebionix, our current venture. In Telebionix, we design products that are for healthcare, that are personal healthcare and well-being products and electronics. Biosignals is our concentration and biomarkers detection. So that's where we are today, and I'm happy to hear with the rest of the family, panelists, and family now that we know each other. So good morning and good afternoon to everybody.
Thank you, Widy. Ryan?
Thank you, Anca. Well, it's a real pleasure to be here with everyone today. My name's Ryan Abbott. I'm a physician scientist by training and an attorney. I help companies largely in life sciences and technology to commercialize and develop new products. And I'm also a professor at University of Surrey in the UK, where I focus research on regulation of digital and emerging technologies, and have recently written a book, The Reasonable Robot, Artificial Intelligence and the Law, which I think got me invited to this panel, and excited to be talking about this with all of you today.
Thank you, Ryan. And Joao?
Hi, thank you, Ryan, and nice to connect with everybody. I'm delighted to be here. Anca, thank you for setting the scene and that amazing introduction. My name is Joao Bocas. I'm the Chief Exec of Digital Salutem. We are a digital healthcare transformation company working globally. Personally, I've been in healthcare for over 20 years, and I'm very interested in health, wellness, all things around fitness. My background is actually in professional sport, and I've always been in health in the last 15 years in healthcare. But the last 5 years, I'm very involved on the global scene in digital health innovation, and also I have an interest in wearables. And my company now, we are actually working with the best healthcare solutions in the marketplace. And you mentioned COVID, you mentioned remote monitoring, you mentioned wearables. And to finish you off, I can just go back to your statement. We always heard that health is our biggest wealth, but I think that really applies now, putting things into context with the global pandemic and what is really important for people and for most of us. So delighted to be here.
Well, thank you very much, Joao. Thank you to you all. I want to start this debate by talking about what you anticipate as the future of healthcare and well-being after the COVID-19 pandemic. I think that we've spent the last couple of months talking about COVID, about the vaccine, about technology during COVID. I want to leave it all behind and focus on the future on what is to come. We know that today we are at a very important moment in time where we have a convergence of the public interest and public awareness about health and technology and well-being. We also have a lot of big companies ready to invest and develop new solutions. So it's really a key moment in time. What are your thoughts on this particular moment and on the things that are to come in the next couple of years? Maybe, Widy, you want to start? Your microphone is on mute.
Yeah, if I may, I just want to break the ice on that one. I think that the experiences of last year kind of got people a little bit more interested in their own health and taking control of it a little bit more. People understood that we cannot rely only on governments and big organizations to take care of that for us. So I saw a big shift on people getting very interested in how am I going to manage my health, how I'm going to make it in a way that it's comfortable for me to receive healthcare. How is it that I can control the information data that I create on my own by taking care of my body and wellness? So I think that the industry is also reacting to that new position that their quote unquote customers are taking, right? So I see an overall shift into a direction of a usually institutionally controlled system to a more of a personal control system. And more on a one-to-one with the patient, and not the patient as a second tier on the healthcare program. So that will be my point into that.
Well, just to follow up on that, I suppose I agree with it. I think we have seen kind of a breakdown of some of the way that people have traditionally gotten healthcare, which has both exposed the fact we have inadequate safety nets, at least in the United States, for underinsurance and uninsurance, and the means in which we provide people benefits that have a strong impact on mental and physical health. But we've also seen a lot of people having more time at home, wanting to take more control over their own health. And I think digital technologies in this space have a lot of potential benefit for patients so that they can have more awareness of how they're doing and what they could be doing to improve their lifestyle, their exercise, their eating habits. I think this has been part of a larger shift in people kind of moving away from traditional sources of medical authority and democratizing information. And that has a lot of potential benefits, also some risks, as you know, something that your doctor tells you may or may not be as good as something you have elsewhere found from the internet or been told by a digital diagnostic. But some of these digital diagnostics too are getting far more advanced, and may potentially automate some of the things healthcare providers did in the past. Last year, for example, we had approval of the first autonomous diagnostic software. So you can have an AI now that diagnoses someone with macular edema or diabetic retinopathy without a physician involvement. So I think, as Widy said, we're going to see a lot more digital technology being used and a lot more patient-driven use of digital therapeutics.
Thank you, Ryan. Prakriti, maybe you want to jump on that?
Yeah, I would love to. I always take everything from the lens of mental health and well-being. So mine's going to be a slightly different approach. I feel like this period has really been the pandemic of the mind, more so than anything else that's happened. People have been extremely vulnerable. Your daily routines have been sort of disrupted. There is no stability in how your life is and what's happening, because this unprecedented period is totally, has been unconventional for most people, and that's an easy word. It's beyond that, but it's been difficult. And it really has made death come face to face with everybody. Where we actually believed that we would live forever, everybody is worried. And the mindset, according to me, has really changed, because we actually look upon each other with fear as well. Where communities were so important, gatherings were so important, we crave it, but we look upon it with fear and with judgment, a judgment about how other people perceive, how they perceive risk as, in the basis of this. And you may ask, why is this important in the wellness industry? Because everything, of course, is going online. And more we see alienation come through. And extended periods of unrest such as these would definitely cause things like PTSD eventually. We can already see that that mental health is taking, the mental health of people is taking a toll. And how do we, as supporters of well-being, provide a basis to help and aid them? It's not easy, especially if we're saying, especially if we're doing, AI-driven work, and if we're having robotics take precedent, and as we're moving more and more to science, we're moving more and further away from the human sort of intervention. Even when we say doctors are, diagnostics is going to be online, and you have a non-human, taking care of diagnostics. And I find that obviously it's needed. So it's a double-edged sword. But I do find that will take away so much from intuition, from human connection. And currently, and this I find important. We as human beings are getting information from another person by interacting with the whole body. If you look at communication, there's 93% of communication is your body language, 7% is what you're saying, right? And now we're only these floating heads focusing on the 7%, and we expect people and technology to gather the 93% information, which is not visible. And it really is a difficult aspect. And, fostering good habits like Ryan, you were talking about in terms of fitness. And I think, fitness goals, nutrition, health, these are all great things. But I found that the elite have access to this. But the people that are suffering, who are more vulnerable than most, don't even have the time to think about that. And yet I believe that well-being and the way in which we look at well-being, especially in the coming era, needs to be built for everybody. Democratize it across the world. And how do we do that is something that we need to start thinking about. And I think that I want to leave it there and let Joe continue the train of thought and bring his own on.
Thank you, Joe. Yeah.
Prakriti, thank you so much. My head is just, if I'm honest, just buzzing with ideas, because I want to address the question in such a fundamental way. But going back A couple of things, really. One, focusing on the technological side, I think the pandemic really highlighted what we're supposed to be doing. And in here, we're trying to look forward, looking ahead, what we're supposed to be doing or what we could be doing, but also really highlight the gaps in health systems, in terms of population health, in terms of the vulnerability of the human being, but also the systems. And I'm not just talking about the COVID situation, I'm talking about the way health is actually delivered is fundamentally wrong because healthcare is very reactive. I mean, the governments talk about um, population health preventative measures, but nobody is doing preventative measures because of all the same cycle. Who pays for it? How does it work? But Ryan mentioned, for example, in the United States, the payers and the insurers starting to kind of waking up for this new shift. The dynamic is actually changing because the power is in the hands of the consumer, and that is changing now. And we, with the pandemic, we really see that. I was actually doing an interview on my YouTube channel around healthcare technology with one of the biggest thinkers, and we talk about patient centricity, but patient centricity not being enough anymore is about patient design. And I'm from the times like 20 years ago from corporate wellness where you have the pedometers. If you had a pedometer to do 10,000 steps, it was such a big deal. But let me remind you that I could not talk about wearables. Fitbit launched its first wearable in 2009 and the second version of the fitness tracker in 2011. And now we really see the value of self-monitoring, but we're going beyond wearables now because we have so much technology that is embedded in our phones. We have face apps that diagnose vital signs. We have remote monitoring by only room installation with Wi-Fi, with new emerging technologies. We're heading in such a direction in the technological transformational side that I think in 5 years' time we will not recognize the things that we're talking about now. But there are many fundamental issues to consider. It's a very complex kind of issue to move forward, but it's also fascinating at the same time because I really see things really evolving. I think the pandemic kind of served the industry really well, not the world, but served the industry really well to push the agendas forward.
I would like to add a comment because I think that Prakriti point of view is very interesting. When and I'm gonna now talk from the side of an RPM designer and lead of a group that it's working on that particular one. From our point of view, we do not intend to take away the human factor when you're talking about well-being. There's no way that we can substitute that. We are on our DNA. It's embedded there. It's there. We need that human interaction. We need to definitely have that on the equation. I think that the situations we've gone through on the last 20 months, if you want to put it, maybe 18 months. What that brought up is that even though we are an extremely advanced society, right? There is a disconnect on the wellness of global wellness overall. It is not distributed. That technology that can help support well-being is not distributed equally, and not only that, but it's not covering the basic needs of what it's needed, right? Of what is required, I should say, to have the technology that is today working in pro of well-being overall. I mean, we have, for example, things that have been in the market for the last 20 years, which is telemedicine and all of that, but it's lacking a good support technology that can make that particular thing work in in pro of having a better interaction. I think that well-being also on the psychological side requires technology to back it up, so that we enhance the experience between the provider of psychological treatment or PTSD or anything like that, or helping a patient with PTSD. I think that technology just have to catch up with the human factor. Technology just have to be a tool that allows that human interaction to be better, more efficient, and to give both parties in a conversation give information that it's just a supplemental information. That has not been done correctly up to this point, even though we're super advanced in technology. And I think that we, the technical people, need to understand that the human factor is never going to be taken away, that we are just enhancing the experience between two individuals, being a healthcare provider and a patient, or even two people just supporting each other in well-being.
When we look at what are some of the things that patients want from their healthcare system, some studies are showing that these needs haven't evolved much in the last 20, 30 years. Patients still want better, faster, cheaper access to care. And no one ever wants wearables, telemedicine, artificial intelligence, voice assistants. Those are just enablers for better, faster, cheaper care. And this is the end result that we should focus on, rather on that designing these very advanced technologies, and without really worrying about how are we going to use them? What is the final goal that they're addressing? And are they designed to address the needs and what patients want at the end of the day? And I think that's really an important aspect of patient design, and involving patients in the design and the whole process of creating innovation in healthcare. And that perhaps is something that we're missing, and that's starting to evolve a little bit more today, where patients are really taking part in the whole process rather than just being the end user and the end consumer. That's a kind of a change in the way that we see healthcare and innovation in general.
True. If I can add to that point that we're talking about, I think, it's really important to understand that we're designing for a global economy at this point, right? I mean, it doesn't need to be focused on a particular country anymore or a particular culture. And yet everything that we do in terms of the human psyche is cultural. I mean, the way in which I approach psychology in India would be very different from the way it's approached here. What we call self-love here, and I know because I build meditation apps, and we build meditation on apps and tools, which actually help steady the mind. When you go into cultures like India and you talk about self-love, they see it as selfishness. So when we're talking about habit formation and we're talking about what can we do, it's very different in different countries, yet we're building for that. So you're right, it's very important to keep your ear to the ground. And I know that when this COVID started, March of 2020, I started a helpline in India and connected the Rotary Club and a whole lot of other mobilizers. And we thought that this helpline would be, like, we wouldn't be able to really service the people that would call. And there were 700 volunteers on it, and they still are there. And people called, but despite the fact that we had mental health at the core in the center, they were calling about supplies. They were calling about, give us things that can assist us, not with our mental health, because it was a very far away sort of cry. It was more about like, where do I get my rations? Where do I get this? Where do I get that? And so I realized at that point that if you have your ear to the ground, it's a network that needs to be created for health and wellness. It's a network like what Widy just said before this. The network is super important, because we may think that something's important for the patient who's calling, but that may be the tip of the iceberg. There may be so much more. And if we actually have ourselves open to it, I think we're really creating solutions that would be beneficial. And I think it's almost time, even though this has been really, and companies have been building it out and investing in new models, I think it's really time to go back to the drawing board almost and really think about what's come out, what's come out as ahead of the race, as to what's needed for people. Because more and more, I mean, when I see it, and we're interacting with humans, I mean, the fact is that the technology is not predicting what human reaction is. Human reaction should be predicting what technology is. And if you're talking about that, we have to play a part in the whole. And when you start talking about what is that whole, you need to, like Anca, you're saying, go back to the drawing board, listen to what people are saying, listen to what individuals are saying, and make sure that we're, sort of working together. Because if we've learned anything from this particular situation during COVID, is that every single one of us impacts the whole, right? I mean, there is no one is isolated in that manner. We're all impacting each other. And how do we create this sort of concept in medicine? How do we need to start focusing on, so telemedicine, consultations, again, it's kind of different in each state almost in the US. So these are important factors to kind of look at, like, how are we creating a model that is universal in a sense, so that the predictors are universal, yet have, a cultural application adapted to it, so that the results because since, like you said, one of the important things is that we don't have enough access, and this would help sort of bridge that gap. And in that case, it needs to be extremely thoughtful about integrating different cultural aspects to a uniform platform.
Just to kind of jump in on that too, I think those were some great points by the past panelists, in part about the need for access to healthcare. And digital has a tremendous ability to improve access, or at least a tremendous potential to. Even a year and a half ago, if you had asked a mainstream healthcare provider to see you in a telemedicine visit and otherwise to get on Zoom and talk to them, 9 times out of 10, they would have said, forget it. And, potentially they would have run afoul of regulatory restrictions in their state in the United States, or it would have been considered the unauthorized practice of medicine if done across borders. One of the positive features of COVID has been that it's really forced the medical community and regulators to reconsider some of those positions, because frankly, it couldn't work anyway. And that could allow even physicians in the United States to be treating people in rural areas of the world and to be using diagnostic products that would allow them care that they wouldn't otherwise have. But just because digital has the potential to improve access doesn't mean it will. One could imagine another vision of this where we have a whole bunch of very intrusive medical devices that are nudging us towards behaviors employers and insurance companies think will be more profitable, and really infringing patient autonomy and replacing someone's ability to see a human provider. And that, of course, wouldn't be a desirable outcome. Companies have a lot that they can do here. Regulators do. Companies with good corporate governance and keeping in mind things like Anca said, that we shouldn't, we should be considering the way these technologies can benefit people by making things better, cheaper, and faster, not in creating a bunch of perverse incentives. And consumers have a lot they can do about this too, by, voting with their feet and using digital technologies that have best practices that help improve their lives.
Well, thank you, Ryan. Following up quickly on that, Anca, you mentioned the co-creation, in other words, which is extremely important to bring the patient from the beginning and create solutions that will be successful in the future. But one area that I'm really focusing on is digital transformation in healthcare. And Prakriti mentioned how healthcare is so complex, so complicated. I mean, digital transformation in its own right is very difficult to achieve, but then healthcare is such a peculiar industry, is very different than banking or fintech, or hospitality is very, very, very different. So we have the cultural changes, we have the processes, we have the clinicians, we have the patients, we have so many dynamics. The clinicians, they don't have time to look at the data. We don't have the means to train the medical professional. The medical professional cannot come out of their bubble to seeing 40, 50 people a day. So it's extremely difficult and it's very complex. And also organizations, sometimes they start with the wrong way around. They start with the digital transformation layer with the technology on top. And you have to look at digital skills, you have to look at accessibility, patient design, which we mentioned before. So many things, processes. I'll give you a quick example. The NHS, the last 15, 20 years, been heavily involved and focused on process consultants to change management process. The technology was disregarded, and also never included patients. Only now, for example, in UK, and I work globally, but I know the NHS very, very well. Only now we have accelerators, we have collaboration with startups, we start to bring patients to the conversations and to the design and start to do things in a more effective way. So I think we have a long way to go, and I truly agree with other panelists about digital transformation being actually cultural transformation. It's not about the technology. The technology is just one element that fits in probably in a third or fourth slot, if we may. So I'll leave you with that.
If I may just make a final comment, Anca, before we go to a variation of the topic. I think that if we needed to summarize what has happened and where we need to go into a very simple sentence, I have the luxury in my position to talk to incredible advisors. In this case, I'm gonna mention a comment from one of our top ones, Dr. Samer Ellenham. He told me something that stuck in my brain, and I need to share with you because it defines this. Where I was talking about healthcare with him, and he just come back and say, let me correct you. Let me stop you there and let me correct you. Up to this point, the system has been designed as sick care. Healthcare is what we need to get. The system has been designed as sick care up to this point. Nothing has been seriously done for preventive medicine, right? And for well-being and for all of those things that will make sure that you reduce the amount of people that are going seeking sick care. And if you think about it, that's a deep thought, and it's true. It's completely true, and it defines what we have been doing wrong, and it also defines the path that we should be taking forward. We should use technology. We should use the human interactions. We should use healthcare. The redefinition, the opportunity that history has given us to redefine healthcare because of the experience we had just last year. We should think about how do we really move sick care to healthcare and make truth to that name that we're giving the system. That will be my last point there.
Absolutely. In preparing this panel, we were talking about the fact that perhaps in the future, being a patient won't mean being sick anymore. A patient is just someone that wants to improve a health level, whether it's health, well-being, mental health, whatever it is, just feel better in general, no matter what the baseline is. So I think that's really interesting. I see there's a conversation going on in the comments that's really interesting about the fact that today we have technologies such as virtual reality, 3D printers that can change a lot of things in healthcare. But are we ready to embrace this technology? First of all, is the healthcare system ready? In some countries, it's really hard to change the health system. We've seen it with the COVID. Are patients ready? Do they trust these technologies, or do they need more education on this topic? What are your thoughts on this?
Like I said,
I will start just really quick, and then I'll let the panel go. Technology is inevitable. Technology is a path that we cannot. It's just so organic at this point that we will have to learn how to use it. That's really the mission. The mission is that technology is exponentially going to be developed. New technology and incredible technology is going to be developed by the second, and it's being developed by the second, right? So it's inevitable. It's something that we will have to learn how to use. The secret sauce here is how can we responsibly do that? How can we, on the technical side, how can we not only think about pushing technology out there for generating revenue, but pushing technology out there that is coherent with a complete solution, and that's what we're not doing. I think that right now everybody is doing their own thing. I think that everybody's trying to define the path. but we're not having serious conversations about how all of this technology can comprehensively and as one go to a common goal. Devices are created for similar providing similar service, but using completely different communication system. We're not standardizing. We're not cross-referencing technology one with the other. We're really not using the engineering that we know how to do in a way that we sum up all of that technology into a mega plan, right? We're all in our niches, and I think that we need to correct that.
I agree with you. I think that, but going back to the question that was asked, I think there's an overall deficit of trust in the landscape at this point. I mean, even though, of course, there's a herd mentality, and you know that people are going to be taking the vaccines. It's almost like a forceful intervention that's being done. And even if people have different opinions, they're still going to follow it. So I don't think that, I think one of the things that we have to understand is the safety of the larger group is more important than your individual thoughts at this point. And that is why people, even though there may be, and I do a lot of therapy for people, and I've heard so many real thoughts around this, where people are not happy to take the vaccine, but really feel like there's no choice and will do it because of that. In fact, I mean, we know this as a norm for people in the sense of constantly, second guessing, second guessing truth and reality, and nobody knows what it is. So we have to just go along with what is best for everybody else and what the decision makers are actually putting forward, because everybody is looking towards sort of optimizing health and wellness, and I think that is something that we cannot avoid to play a part in as members of a global citizenship.
Thank you, Prakriti. Very quickly to follow up, I saw the pop-up banner about the VR and the 3D technologies. I think we are really ready. The industry is maturing. I give you an example. One of the leading healthcare thought leaders, Professor Shafi Ahmed in UK, performed a VR operation with a medical type of training on YouTube 5 years ago, and they have over 5 million views. And from then on, I think that tells us that the potential is there, but now the adoption is there. I was doing a keynote for Bart's London College University for some medical students talking about wearables. I think these things are really happening now, a huge value. The other point that was there on YouTube was about what's happening in the hospitals 15 or 20, in 10 or 15 years' time. Hopefully, we don't go to hospitals in 10 or 15 years' time, unless you need a major operation. Because with the revolution of healthcare and the home care, we can do more or less anything at home, unless, as I said, we really need a major intervention. So that's where I see really things changing, and we can really embed technology in our lives, and to do things such as blood pressure monitoring, we can do that ourselves. Of course, if we have the right equipment and some kind of level of comfort training that we can do it. And it's about confidence, because most technologies are actually very easy to use. And that's another thing about healthcare. The perception of healthcare, that it is complex and is difficult, and is not. In all essence, is very, very simple. I mean, medicine is slightly different, but healthcare, many people think that it is actually very complex, but it is not in layman terms.
Well, no, I agree with that. As Joao said, and as you said, some of this is more education, and some of it really requires quite a bit to be integrated. So if you think about something like blood pressure monitoring, which, with technologies we have, one shouldn't have to go to the hospital or even a clinician for. We have radically different ways of potentially doing this now than we tend to, which is someone comes into a healthcare office and gets their blood pressure taken. With wearables now, you could have 24/7 monitoring of your blood pressure, which is probably going to be substantially more accurate and have a lot more diagnostic, predictive, and treatment value than the way we're getting blood pressure right now. but it's also not something that providers are trained on how to engage with. It's not something that all patients are doing. And so, incorporating and revising kind of daily healthcare practice to take something like that into account is really quite a leap. And that's with a very basic sort of thing like blood pressure monitoring. When you get to something like, doing surgery in VR or robotic, surgical machines like a Da Vinci robot, these are very exciting technologies, again, with a lot of potential. But before rolling them out on any kind of widespread basis, you also want to make sure that they have good objective data, that they are safe and effective and better than our existing practices. And someone asked a question about why the vaccine took so long. Well, it was the fastest anyone's ever come up with a vaccine in history. And it is very complex to develop a vaccine, roll it out, and then ensure it's more likely to be safe and effective than the alternative. So, we have a long ways to go to bring some of these potential technologies into the system, starting with making sure that they're likely to result in more good than harm.
I think there was a great comment and a question, more than a comment, a question on the comment section. Somebody asking how will this technology affect the healthcare employees or providers or first responders? And I think that it will be exactly as every other technology. I mean, the technology is just going to enhance the service. It's going to make the service to be provided easier and more effectively. And technology is not something to fear. It's something to embrace, but it's also something to keep close track of, right? So to all those first responders that are hearing us talk about technology and all of that, this technology is just going to enhance the work environment. It's going to improve the level of service. It's going to improve the accuracy of that service. So I will not fear it. I will embrace it, but it is our responsibility also to track it and make sure that the technology is going in the right direction, is being used as the right tool.
We've been talking a lot about the fact that healthcare is moving towards the patient. The patient is becoming the point of care. What about the other traditional players of the healthcare sector? I'm thinking about hospitals because we have a question about this. What will be the role of hospitals in the future, let's say in 10 or 50, 25 years from now? What role will they play? How will they adapt to this new way of using technology, this new view of the patient?
I think a lot of that is already taking place. I mean, I see technology is really fast adopted in like the larger cities in India, right? Just because it's necessary, and I think people are used to sort of cloud safety of patients' information. I mean, we know it's not 100% safe in the SSL socket, not exactly the best, but it's being adopted, it's being used, and also there's a shift going on where you can actually. So there's a lot of brain drain, as you know, in India, and and the youth really need to take care of their family members, and so therefore having it on the cloud gives them access to their family and loved ones and the state of affairs of their well-being. But apart from this, I think that with the rapid decline at this point in the health and wellness space of people's interpersonal relationships and their inner relationships with themselves, I think more so people are going to extend themselves to using technology just because it's a safer way at this point, and very soon it may follow in habit. But do we have the systems right now for safety measurements? I think this is a question that goes more into how have human beings evolved, and I'll tell you what I mean. I've been applying because like I said, I live in India. I don't think I've said it to everybody else, but we said it backstage. But I live in India, but at this point I'm here in Vancouver. And when I'm applying for schools, because I'm moving my children from the school that they were in temporarily to another school, when I'm applying for schools, they always ask me, about the mental health of my child. Like, has he ever gone to a psychologist or has he ever needed to? And this is kind of important because even in the workplace, this is a question that comes up now. I don't know how much it's allowed or not allowed, but I do know that human beings haven't evolved enough to be non-judgmental, and bias still exists. When we have a format where everything is online, and it creates a huge amount of visibility, it becomes like everything with technology, a double-edged sword, because how much of yourself can you put out there, and how much of yourself are you willing to expose, and how much are people willing to hold you without judgment based on that? I think it's a very critical question, because when people are looking to employ people on their staff, or workplaces are looking at well-being, because all of this kind of connects, and all your records are semi-sealed. I'll call it semi-sealed, because we're building towards making sure that it's more secure. It's not that easy. It's not that easy to be transparent, and it's not that easy to go online and seek help, because eventually there's a matrix that at some point is the blueprint of your life, and it is visible. And I think we need to really pay attention. And I know companies are doing this, and everybody wants to do this, to pay attention, but there are enough hackers out there. So it's extremely important that we focus on the safety measurements that we have as we start building towards technology.
That was a great comment. One of the things to pick up on was, I think, your comments about bias. Digitals are also interesting in healthcare because of both their potential to decrease existing biases or to exacerbate existing ones. So we already have healthcare that is unfortunately biased in the United States against, certain groups who tend to receive worse sorts of healthcare outcomes, whether that is, structural or unconscious bias at work. For example, if we go back to Joao's example of talking about blood pressure monitoring, some groups of individuals in the United States have worse outcomes with blood pressure monitoring, and then with associated problems you get from that, like having heart attacks or strokes. Having digitals that help to monitor someone's blood pressure, then essentially in some way independent of existing healthcare providers, and making recommendations about that, have the potential then to help level the playing field in terms of people's outcome. But on the other hand, if we just adopt these in an unthinking sort of way, and, we have machine learning algorithms that are learning from what people have done in the past, we might also get AI helping to entrench and further widen those disparities. So this is something also that consumers and regulators and businesses have to be very mindful of, and that businesses should be making efforts to both display good governance and awareness of these issues, and to be transparent about how their AI works and digital technologies work, and making sure that they are regularly monitoring it for these sorts of outcomes.
Prakriti, I think you've touched on a very interesting topic, and I want to spend the last 10 minutes talking about this, which is the use of our personal data. I think this is a topic that was very much talked about during the pandemic, because as governments developed those contact tracing applications, a lot of people worried that they were tracked and monitored, and all of their data was used to know every single aspect of their life, and they were not comfortable doing so. That's also very cultural. In some countries, they were more open to it. In some other countries, they were really close to that. I want to know, what are your thoughts on this? And maybe starting, Ryan, from a regulatory perspective, what is the regulatory context today around data privacy, whether it is in the US or other regions of the world?
Sure. Well, it's a complex framework for that. At the one level, you have kind of legal requirements or regulations around what you can and can't do with data, particularly around things like patient data. Different jurisdictions, different countries have different rules about this. So in Europe, one of the leading laws is the GDPR, which restricts how people and under what circumstances they can take your data, and how they can use it, and how they have to maintain it. In California, there's a law called CCPA. In the United States, we have another law called HIPAA that restricts privacy around collection and use of identifiable healthcare information. Those are all laws that, companies and ethical or large companies know about and just have to follow. But on the other hand, they set a bare minimum of behavior. They aren't kind of the values to which a company should aspire to gain the trust of its consumers. And there are a number of best practices that companies tend to adopt, and particularly, balanced against the sensitivity of the data. As Prakriti said, people are used to giving their data to things online. It's really inescapable that it's all over the place, or with things like contract tracing, that if someone was so inclined, they could figure out just about everything about you, from where you're going and who you're meeting and what you're doing. And companies have a legal and an ethical obligation to protect consumers' data like that, to the extent of its sensitivity, certainly, but also to encourage trust in their brands.
Is there, from a legal standpoint, such thing as a sensitive data? Because I feel like for a patient or a physician, it really depends on the context. For someone that's healthy, maybe some particular aspects of healthcare are not sensitive because they just don't care if it's leaked or whatever. But for someone that's sick or has particular health issues, then the same data can become sensitive. The same with mental health. Some things can be sensitive for some and not sensitive for others. How do we position what is sensitive and not sensitive?
And I think that you answered the question right there when you were stating the question, because the sensitivity of the data is defined by the user, and that's where we need to put the power of again on, right? It's the user. The user should own the power of its own data. It's his healthcare data, right? What other asset do you really possess that your own body and the data generated by it? So I think that it is the user that define what it's important, what is data that he's willing or not willing to share, and at which point it's willing to share it. From the standpoint of an RPM design team and manufacturing team like mine, it is our responsibility to make sure that the integrity of the data is there, and that we give the power to the user to share the data as so desired, and in the extent that they want, and to the specific parties that they want. So that will be what we need to provide. It's just power to the user again.
And if I can add to that, I think this is a really important question, and I really want to spend like a second on it since we don't have that much time. But anyway, sensitivity is important, of course. Personal data, according to me, human beings don't have that much foresight. So what is sensitive to me at this point may not be sensitive to me. What is sensitive to me what is not sensitive to me at this point may be sensitive to me at a later stage in my life. I need to be capable of going in there and editing that. And I'm not capable of doing that right now. I'm not capable of editing the information that is online, because once it's out there, it's there. It's somewhere around, and I'm unable to edit it. And I think if I'm able to do that, because as a youth, so say for example, I am a 21-year-old, 22-year-old, and I'm going through all my challenges, and I think that I am open about it. And I will splash it anywhere. I will be able to kind of communicate with this. I'll be able to put it up. I'm not thinking about how this is going to impact me in the long run. And it will impact me in the long run, but I'm unable to, at that point, go back and edit that, because I've created a blueprint for my life. And I think this is an extremely important aspect that somebody needs to be able to build in the technology system. What can I go back and edit? Of course, I can edit it on the platform that I'm on, right? And that I'm able to do. But it is in the World Wide Web. And it is always going to be there. And how do I create systems that are going to help and aid that, so that I can be protected not only now, but also in the future?
Right. Well, I'll give some final thoughts as well. When people mention data, I want to pull my hair out sometimes, because my experience is the last 6 years I've been in hundreds of conferences around the world talking about data, and it feels like it's an endless loop, and also is a bit frustrating, because sometimes we have an amazing panel. That was not our case. That spends an hour talking about data and we don't get anywhere. But anyway, let's move on from that. I think any health data is, without being controversial, is sensitive data, because you can't really have layers of sensitivity or benchmarks. A hierarchy, sensitivity number 1, 2, 3, and 4. So personally, I don't actually put much emphasis on my health data. You can share it on my Fitbit or my Garmin or whatever, but that's personally. Yeah? And also, most of the health apps that you download, you agree to share your data because it's in small writing that nobody reads, but also is already kind of forced to share the data, which is a bit unethical anyway. But also, my other point is I've done a 159 pages report on health wearables engagement, and we talk about the barriers of the user barriers and also the device barriers. And from the user perspective, the security and also the ethical side comes like third on the list, very high. So people are actually concerned. And wearables are great. They generate data. Is a big thing about wearables not being like the next big brother. People know what you're doing, for example, from corporate side, the employers knowing if you're sleeping less or sleeping more. So is a big ethical issue in here. But for the purpose of using the data, and I finish with this, most people, for example, 70 or 80% agree to share the data if it's for a good purpose, to cure cancer, or is for in benefit of medicine or research or third world health. So it's just that matter of trust that needs to be explained, why we share, why we should share, or why we should not share. But it's actually a bit of work still to do, and we have quite a long way to go, to be honest.
I think data can also be seen as an equity, and right now, yes, we're sharing, and people are sharing, and a lot of people are benefiting out of the data, but the person that is sharing that data. I think that when we're talking about giving the power back to the user, to the person, I think that it's also giving the power to treat that data as an equity, and I think that even equity that they can monetize on that data. When we're talking about sharing this data, we share this data with people doing research and people doing all of that, and if you own the data, you have the opportunity to also monetize on that to the level that you want, anonymize it, but then monetize on it. I think that we're not looking at data the right way. The right way is data. It's the owner of that data should control it, should decide where to share it and how to share it. Like Prakriti said, should decide what it's editable and what's not, and control that also. But also taking advantage of treating it as an equity. In the future, I see that as something that is going to definitely happen.
I think if I can just add, Widy, I love your points. I mean, I love everybody's points, but every time you say something, I'm like, wait, there's one more thing to be added here. I think what's really important at this point with the comment that you've made is really to go out there and educate people on data. And to educate them is because not everybody understands this. Not everybody understands how to monetize it or what really, what is the larger picture here. I mean, we're assuming people are capable of that assessment. But I can tell you, if I was just to do maybe a back of the envelope assessment, I would say that 95% plus. I mean, that's actually 99. I would say 99, but don't know this, right? They don't know that they don't even have the bandwidth of understanding how much information they're giving out and what really is happening with that information. They don't know about what kind of risk reward ratio is going on. They don't know what the profiling is doing. They don't know what this collection of data is doing. And I think if you could educate them, then I think that things would be much better and people would be able of taking decisions that were intelligent. And I think information, education, communication is what's required before we start taking data, because even though I might sign my rights away in the small print, companies have to know ethically that nobody is reading that, and and if we're not reading that, we of course it's our problem and our fault because we are not aware of what we're signing away. And I think that's why I'm saying maybe let's also as people and companies that are looking at this forward-pacing this a couple of years down and ensuring that it's safe enough for everybody to be engaged, that we focus on IEC, which is your information, education, and communication around these subjects.
Ryan, you want to add something?
Well, we're almost out of time. Do we have a moment for a quick reply, or do we need to wrap?
Go ahead.
Oh, I was going to say, well, no, I like Widy's point. I mean, I think when you call it an equity, you're kind of referring to it as property. And, data ownership and having data be property is really a very complex issue. In part, we grant things like intellectual property rights, like copyright or patents, because we're trying to get certain behaviors out of people, like inventing things or creating new things. But it's not so clear with data ownership what we'd be granting, because it's a very complex ecosphere with lots of different parties involved in data creation. People are, making it anyway because it doesn't require additional incentive for them, or because they get some benefit from doing so, even if it is kind of access and use of an app or something like that. But I definitely agree with Prakriti. It's, important, the costs and benefits of using an app, and no one reads the fine print on user terms or bothers to understand that. Even so, data does generate a lot of value for not only users, but society, in part by letting us use it to make and develop new processes. And maybe one of the solutions to something like companies benefiting from people's data like this is to have kind of other sharing schemes where, either they are contributing more economically through something like taxes or otherwise. But data ownership is a very complex issue.
I think we would need a whole other panel to discuss data ownership and data sharing.
A couple of hours.
We are reaching the end of this panel. Thank you all so much for participating. From what we discussed today, technology is here. Technology is changing the healthcare industry. There's nothing we can do to stop it. But as people working in healthcare, I do believe that it's our responsibility to raise awareness about the ethics and everything that we have to know in order to better use this technology to the benefit of the patients, and also educate all the users about how to use it correctly to improve their health, well-being, but also to prevent complication and to prevent getting sick, etc. Thank you all again so much for participating. Thank you to all those who sent your comments and your insights as well. It was really great to moderate this panel, and I hope to see you all soon. Thank you very much.
Thank you so much.
Thank you.
Bye-bye.
Take care. Bye-bye.